let me ask Lucy Jones to say a few words as well. As you know, she's a preeminent expert in the area of earthquakes, and was really the force behind the Great California Shakeout, which became the Great California Shakeout.
Thank you, sir. I'm Lucy Jones with the U.S. Geological Survey, and we are very happy to be partnering with the City of Los Angeles to improve preparedness for all disasters here in Southern California. We are the scientists that are trying to understand what the risk is, and we need to make sure that we effectively communicate that risk so that you know what you should be preparing for. And we are very glad to be continuing in this process and working with the city in understanding the risk and acting on that. I would just like to comment, I know there's been a lot of concern about watching the Pacific Rim all have earthquakes and how things could change in California. We don't see a significant change in our risk. So don't be more worried today than you were a week ago, but don't forget that this is earthquake country and it's always a possibility. And we're hoping to be there with the city and with our other partners in helping us all get ready for it.
Thank you, Ms. Jones. And I mentioned the County Fire Department and the Sheriff's Department, who we work seamlessly with, but we also work very, very closely with the County Public Health Department, and with us today is Dr. Fielding.
Thank you very much, Mayor. You know, this is a wake-up call. We had a threefold disaster. It reminds us that we can have disasters at any time, often without warning. And however, the pictures that we all see on the television of what's going on in Japan, and it's very disturbing, should not be translated into fear here. When people hear the notion of increased radiation, that engenders a lot of fear. But we have no reason to believe, based on everything we know, that there is any problem of harmful radiation in Southern California linked to the Japanese nuclear crisis. Let me repeat that again. We have no reason to believe that we're going to have harmful radiation in Los Angeles County or in Southern California. Could there be an increase in the background over the background level? Certainly, but remember that when you go up in an airplane, you're increasing your radiation by in the order of 20-fold or more. We have probably 100-fold or 1,000-fold differences between what would be the current background level and a level that would be harmful. We are not going to see that kind of level. So people do not need to do things differently. They don't need to live their life any differently than they would if they had not heard about this. Also, they should not be taking potassium iodide. There's a lot of concern about, do we need to take this as a precaution? It is, in fact, something we urge people who have bought it not to take, and don't be worried if you can't find it. It is not something you should be taking anyway. I think it's very important that we not see ourselves as victims. We are prepared. We practice on a frequent basis. We are survivors. Collectively and individually. We help cities to deliver medicines. As an example, when we have the H1N1 in 2009, we were very active in getting to communities the kind of vaccine that was needed. We create unified plans that encompass all levels of government and ensure the safe delivery and distribution of supplies. We conduct drills throughout the year. We develop strategies to improve our ability all the time. And just as we are making sure that we're better prepared every time, we want to make sure that every individual is, because in case of many emergencies, people will be on their own for some period of time, and they shouldn't be unprepared. So just as the mayor said, I would just reiterate, you need a family communication plan. How are you going to reach your children? How are you going to reach each other? What do? Is there some other number to call if, in fact, the phone lines are down or your mobile service is not working? You need backup plans. And then emergencies. Look over here. You have, next to the mayor, all the things that, in fact, one needs individually in a case of emergency. So what are those things? Well, you need water. You have a lot of water here. You need food. I would suggest that you have those for a minimum of 3 days and preferably as much as a week. Changes of clothing, a flashlight, a first aid kit, any medicines you need to take regularly. I want to emphasize that. There are a lot of people who are on medications that are absolutely essential for their health and well-being. It's very important that people have extra medicines available so that it is there if they need it. A wireless radio, battery-operated radio, toiletries, and tools. You may have to turn off your gas, for example. So I want to reassure you that in any case, whether we have a disaster that's man-made or in fact natural, local, state, and federal agencies are working very, very closely together, and we really appreciate the very seamless coordination we have with the City of Los Angeles under the mayor. Thank you very much.